morning. This is Melodie Pazolt with the Division of Behavioral Health and Recovery at the Healthcare Authority. Welcome to our workshop on recovery housing in Washington. Do we wait 5 minutes or do we go ahead and go now?
You can go ahead and go now.
Okay, all right, next slide, Kira. So I've introduced myself along with my colleagues. I'll let them introduce themselves. We will be presenting to you all information about the continuum of housing that we're trying to develop for the behavioral health population. And so we're going to give you an overview with a little bit of a focus on recovery residences and Oxford houses, which are part of the continuum of resources and options that we're trying to give individuals with behavioral health conditions. And so from the national perspective, Melina, I'll let you introduce yourself, and then Melinda and Kira.
And Melina, I'm going to break in. I'm just noticing sorry about that. We do still have 4 minutes. Why don't we give about another 3 minutes to let everyone join the meeting? And my apologies for that.
No worries.
No worries. We will wait. Thank you.
Kira, do you want to back up a slide then?
Ladies, feel free to start in about a minute, right when the clock hits 11.
I'm not seeing any attendees. Should we be seeing attendees?
You won't see them here in the back end of the platform, but I will be seeing them in the front end of the platform. So that's why I'll give you questions at the end.
Okay, great, thank you.
And you are welcome to start whenever you're comfortable.
All right, welcome everyone. My name is Melodie Pazolt. I am a section manager at the Division of Behavioral Health and Recovery through the Healthcare Authority. We're going to be providing you an overview of the menu of options that we are trying to develop through the Healthcare Authority and the Division of Behavioral Health and Recovery to assist individuals with behavioral health conditions have access to housing. and a little bit deeper dive into two of those strategies around recovery housing and Oxford houses. I'm joined by my colleagues, Milena Stott, Melinda Trujillo, and Kira Schneider. I'll let them introduce themselves to the panel or to the webinar. So Milena, do you want to start?
Yeah, hi, good morning. Thank you, Melody. My name is Milena Stott. I'm an outreach and engagement specialist for the Fletcher Group. We're a national organization supporting recovery housing initiatives, and I am based here in Washington State. And I've lived here since 2004, so I know our state a bit well, and happy to be the boots on the ground supporting our state initiatives around recovery housing.
Good morning, or yes, it is still morning. Good morning, I'm Melinda Trujillo. I've been working in the field for 35 odd years as a clinician. I'm a substance use disorder professional, and I've had the Oxford House contract and worked in partnership with them for the last 16 years. And I work for Washington State Healthcare Authority, Division of Behavioral Health and Recovery, and Recovery Support Services.
Hi, I'm Kira Schneider. I am the Recovery Residence Program Manager with the Healthcare Authority, Division of Behavioral Health and Recovery. I have been tasked with getting HCA's Recovery Residence Program up and running based on the mandate from our legislature on House Bill 1528 from 2019.
Awesome. Well, welcome everyone to our workshop. Kira, if you want to go to the next slide. So we just wanted to kind of set the stage a little bit about some of our philosophies at the Division of Behavioral Health and Recovery and the Healthcare Authority. And these are really from directives from our federal policy administration called the Substance Abuse Mental Health Services Administration. And so SAMHSA really identifies recovery as health, home, purpose, and community. And that recovery is about a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And so, you know, the 10 components of recovery are all listed right there. And, you know, I think a couple of the strongest ones that we really focus on are choice and hope, and just really believing in peer support and really trying to give people as many options as they can to really identify what helps them in their recovery journey. And that recovery is not just this one trajectory that it's 3 steps forward, 2 steps back. It is that non-linear approach to recovery. And so next slide, Kira. So trying to give people as many choices and options, the Division of Behavioral Health and Recovery is really trying to create a continuum that builds upon these 4 elements of health, home, purpose, and community. And so we have different initiatives that address social determinants of health, such as our Foundational Community Supports Program that addresses housing, employment, and then, of course, there's the focus on social determinants of health, income, nutrition, transportation, and really starting to move to a whole person care approach, integrated mental health, substance use, and primary care services, and really just thinking about how do we help that whole person recover from either their chronic health or their behavioral health conditions. Of course, helping individuals with home, we recognize that you cannot recover without home, without knowing that you have a place to lay, a safe and affordable place to lay your head. And so there are a number of initiatives that we have at the division that focus on trying to build home for that participant, whether it's through our homeless outreach programs, through our forensic outreach program, our housing and recovery through peer services, which really builds that mutual support, that peer support, in addition to supportive housing. Of course, our foundational community supports, which are those Medicaid resources that provide the supports and services to help somebody obtain and maintain housing, as well as obtain and maintain employment. And then, of course, we're going to go into a deeper dive into our recovery residences and Oxford houses. And we also have a peer bridger program that's really trying to bridge people out of institutional settings into the home of their choice. purpose, it's so important, so crucial that people feel like they have purpose, structure, a place to go, some place to contribute, and even better if they have income in their pocket. And so, peer services are a way of doing that, as well as supported employment as through our foundational community supports program. We have our recovery cafes, clubhouses, peer-run organizations, community recovery support services, a lot of efforts to try and help people develop that purpose and have structure and opportunities in their lives to continue their recovery pathway. And then developing community. And again, community can be established through peer services, recovery cafes, peer respites, and consumer and peer operated services. So this is part of the continuum that we're trying to develop. We're going to actually turn it over to Melinda to talk a little bit about the national perspective on some of these opportunities. And then Melinda is going to go into the Oxford House. Washington DBHR has invested a lot in the development of Oxford houses. And then Kira is going to go into a little bit deeper dive into the recovery residences. And these are really an opportunity for us to address housing and the housing shortage by using these new behavioral health models. Melina, I'll turn it over to you.
All right, thank you. Good morning again. So Melody did a nice job laying out the foundations of what's happening here in the state of Washington. I wanted to expand on the things that Melody mentioned and talk about them relative to the work that is happening at the Fletcher Group. So when we think about this word recovery, we don't think about an individual. We think about it from the perspective of an ecosystem, right? Because we know that our systems around us influence us and we influence them. It's a bi-directional relationship. So when we think about the recovery ecosystems, we're really thinking about where folks are coming from, right? So, at the Fletcher Group, we work with the criminal justice system, we work with treatment providers, we work with counselors, we work with community supports, and then we work with folks who want to come into this space independent of all of those systems. When we think about a person, we also think about all of those things surrounding them, right? And what they need to be successful. And so housing is the core element of that, right? We need safety, we need security, we need to be protected in a house to begin our recovery journey. As a treatment provider in the system, I did a great job at helping people stabilize and start their journey, and then I sent them back to these same environments that maybe weren't as supportive to their growth. And so we can't talk about health without talking about housing. And then we can't talk about housing without talking about how people pay for housing, and then how people live in housing and how people interact with their community through their housing. Next slide, please. So at the Fletcher Group, we began our work in Washington as a result of the HRSA grant. The HRSA grant really focuses on 3 different levels: intervention, surveillance, and housing. There's this idea that, prevention programs such as, homelessness prevention, for example, help individuals. We're also looking at this idea of surveillance, like what is going on in people's lives and what's contributing to those situations. And then really our focus at Fletcher is housing. So the goal in our work is to build a national recovery housing directory so that folks can search within their relative regions where supportive housing and other recovery housing resources are. Melody and the folks at DBHR and the Healthcare Authority are doing a great job about building that continuum. And our focus is the smaller part of that continuum, which is really on recovery housing. And when we think about housing, we also think about how we support people staying in housing and how we support people housing individuals that have these other needs within the community. And so we think about what kind of training can we offer to folks that help them bridge this gap between health and housing, right? And provide the supportive services within housing to keep folks housed, and then make sure that their outcomes are favorable. Next slide, please. So our goal is really to collaborate, right? So we're not competitive. We don't get any credit for any of this. We partner with state organizations and agencies to really make this work happen, right? We recognize that there's a lot of great work happening in communities, and some communities have different assets than others, and some communities have different needs than others. So my role is to really come into the space and understand what those assets and needs are, and then figure out what we have in our toolkit to help that reality come true. Sometimes that's about housing development and how we increase the housing stock in communities, and figuring out different funding streams to be able to do that. And sometimes that's about how do we operate housing in an existing community. So what are the funding sources that are available to make the housing sustainable and make sure that the people living within the housing have the resources they need to remain there comfortably and successfully. And none of this work happens without coming together within a community and understanding what a community's goals and desires are, as well as their needs. Next slide, please. So really our goal is to have this national conversation around the great things that are happening across the different states and bring information from state to state around different opportunities and different models that have been shown to help vulnerable populations. And our focus really is vulnerable populations from the perspective that we want to be a voice for folks that may not have reach within their communities to express their goals and desires. And so really focusing on this idea of empowerment and how we bring the voice and the need of the community to the conversation. Next slide, please. So how do we do that? Well, at the Fletcher Group, we really provide technical assistance. And so our idea is that there's a lot of great resources out there, and we don't have to build everything from the ground up. So to the extent that something already exists that meets the need of a community, we can meet with communities and understand their needs, and then provide that technical assistance or the toolkit that we have available. Sometimes that also means providing connection to different groups that are working on similar things. Again, all with the philosophy of we don't have to reinvent the wheel. There's a lot of great information out there, and our goal is to make sure that people have access to information and resources that allows them to make their vision come true. In rural communities, which is our target, we understand that rural communities are sometimes limited by workforce or resources or capital. And so the idea really is to come in and bring attention to those rural communities, bring resources to the rural communities, bring information across the state and to different organizations to really understand and tackle these challenges together. And then the last remaining focus is really to help sustain and grow the different levels of housing. And we'll learn a little bit more about that later. In the housing world, where there are some challenges, right? Recovery housing at the national level has been unregulated and has been prone to fraud and abuse. Here in Washington, we have some new legislation that is focused on addressing that and supporting families. There's also confusion, right? How do we spend dollars? And then sometimes there's a lack of resources. So when we're not aligned in our resource, it's because maybe that there's a lack of resource. And so how do communities respond to that and take note of that and take action? So related to the 4 levels of housing, so we look at this from the perspective of like, you know, not everybody needs a lot of support and some people need more than just a little. And so that's the piece around the different levels. So level 1 is really a substance-free environment that is peer and democratically run. And when you go into the level 2, you're looking at how do we incorporate elements of the social recovery support model to add that additional layer of support. We know that isolation is both a symptom and risk factor for substance use disorders. And so creating that environment where you have that social recovery and opportunity to build skills is really important. Then level 3, you're looking at, you know, we're adding a little bit more services. So how are we supporting folks around getting training, education, employment, building their life skills? So we're increasing kind of that level of support and also that connection to providers in the community. And then with level 4, you're really looking at more of like a medical or clinical model where you have credentialed folks or folks who are trained very specifically to deal with certain conditions that we encounter in communities. Next slide, please. And I am going to turn it over to Melinda now, who will talk to you about how the Oxford model fits into that continuum and how that has helped our state.
This is one of the Oxford houses. It's called the Morton Street Oxford House. These houses, when they're open, they always try to be named after the street or the district. Sometimes it gets really hard to name them because some of these places are repetitive. Go ahead, next slide. So I'm going to kind of give you the history of how Oxford even came to Washington State or went to any of the states. So way back in 1988, President Ronald Reagan had a daughter who was early in recovery from addiction. And he wanted to give back to all the states. And so he had signed an Anti-Drug Abuse Act, Public Law 100-690, and that was to establish a national program to encourage mass replication of recovery houses. And he was basing it on the Oxford House concept, and that was only because at that time, Paul Malloy was very well known around legislation. He was a legislator himself, and he was new in recovery himself, I think probably about 10 years by then. And he had started these Oxford houses, and they were well known around the Washington, D.C. area. So the Anti-Drug Act of 1988 allowed states under the Alcohol and Drug Abuse and Mental Health Services Block Grant for federal fiscal year 1990 and to continue indefinitely, hence the revolving fund. Next slide, please. And that, of course, established a statewide program to encourage mass replication of recovery houses based on the Oxford concept, not necessarily Oxford houses. So at the request of Congress, Oxford House Inc. worked with them and planned something that was simple but workable, some kind of startup loan program for each state. So each state was offered $200,000 each to put into a revolving loan fund. And some states took it and some states didn't. And it was a one-time offer only. So just a little bit of history for Washington State. In the early 90s, we got it. Ken Stark was the DASA director at the time. And they just kind of started handing out the money without any policy or procedure, and that money kind of disappeared. So they had to come up with policies and procedures. And at that time, it was determined that they, instead of doing what they were doing, just handing it out and not really having any kind of structure, decided to bring Oxford House to Washington State and had to ask legislature for another $100,000. So the Anti-Drug Act of 1988 allows the states under the Alcohol and Drug Abuse Mental Health Services Block Grant to establish a revolving fund to make loans for the cost of establishing programs for the provision of housing in which individuals recovering from alcohol or drug abuse may reside in groups of no less than 6 individuals. And it's not like a group home or an apartment living. We're talking in a house in residential areas. And they're very careful where they put them. They can't put them by bars. Has to be on transportation so folks can get to treatment or support groups or work. Ensure programs are carried out in accordance with the guidelines published in the Federal Register. And it was dated in 1989 Group Home for Recovery Substance Abusers Guidelines. And because this is federal funding, that has to be adhered to. And it ensures that no less than 100,000 will be available for the revolving fund. Well, they gave 200,000, and we've maintained that and had to add more to it. Opening too many houses too fast. So each loan could only give out $4,000 for each loan, and that was to open the house that would pay the lease and the down payment and furnish the house. Back in the early 90s, that more than covered it. Today, not so much. And each loan was to be paid back within the 2-year period. Ensure that each loan is repaid through monthly installments. And then a reasonable penalty is assessed for the failure to pay by the date specified in the loan agreement. So early on, the loans were getting paid back between 76 and 86%. Feds came in and said, you're not even enforcing the penalties, which was 25% of what they're late on, or $25. It was determined at that time that the chapters, each chapter has at least 6 houses. If the house in that chapter did not pay off their loan, they're close to the last month and it's not going to be paid off, the chapter had to pay it off. And we're now at 98 to 115% payoff. And OHI back east manages and monitors that to ensure that it's paid. This is also, the loans are made only to nonprofit private entities agreeing in the operation of the program established. And this is the biggest bugaboo that a lot of people don't like, but this is part of the federal funding stipulation, is that any use or illegal drug in the house is prohibited, and anyone that violates the rule is expelled from the house. Now, Oxford House folks, when they are voted into the house, then they sign a piece of paper and they acknowledge that if they use or sell or get caught with drugs in the house, they have to be out of the house within a half hour. Now, they just don't get kicked to the curb. They're either sent to inpatient treatment if that's what they need and they want, or sent home, or found another place to stay. And in 3 to 6 months, they can reapply to come back. So a lot of people are under the impression that they just kick them out and that's it. Next slide, please. The cost of the house includes the fees for their rent and utilities and would be paid by the residents of the house. They always try to keep the house, when they get a house, they try to keep it under $400. So this is a particular level of care of highly functioning folks that can get a job or they're on Social Security, some way of bringing in some income. And the residents of the house will, through a majority of the rule of the residents, establish policies governing residents in the house, including a manner in which the applicants or residents are approved. In other words, it's peer run, peer supported. Paul Malloy always liked to say the insane are running the insane. And it works really well. Peer run, peer support. Next. Thank you. So I try to keep everybody up current. This is as of the end of July, I believe. We have 336 houses and 2,918 beds in Washington State daily. We have gender-specific women's houses with children, and men's houses with children. We are finding more and more men are parenting their children. So we have 105 women's, with 45 of them being with children. We have 231 men's houses, and 18 of those houses are men with children. And then go ahead and go to the county one. Next slide, please. I'm not going to read them all off, but you can tell how many houses we have in each county and how many beds in that county. You can tell the ones that are in the highly populated area. They're constantly looking at each one of them to see if there's a higher need, and they are continually trying to open more. We actually have 15 outreach now. Washington State has 10 that they contract with their wages, benefits, and medical. And there are 2 counties that have contracted 2 of the outreach. And then OHI back east has contracted 3 more to help with the load. Go ahead and change it one more, please. So out of all that, we keep a track of how many children are in the houses. So we have 166 children right now. And then there is 160 residents on medically assisted treatment due to the opioid use disorder throughout Washington State. So sometimes you'll hear that someone felt like they were kicked out or were not accepted into a house because they were on methadone or medically assisted treatment. And if they truly feel that that was true for them, then they should get a hold of Jason Bliss, which is jason.bliss@oxfordhouse.org. And he will make sure that they get into an Oxford house. It's not okay that they don't accept them. Usually they're not accepted, not because of the medically assisted treatment. It's usually that person just isn't going to fit into that house. That's part of the peer-run peer support. And that's where we're at with Oxford houses. Thank you. You're on, Kira.
Thanks, Melinda. So this is a picture of Kate's House Foundation, which is a recovery residence in Burien, Washington. I am going to spend the next little bit of time talking about House Bill 1528, and that was the bill that kind of got the recovery residence program started here in Washington State. Back in 2019, a bill was passed by the legislature. It was passed to address the quality of recovery housing in the state of Washington and to help reduce the potential for fraudulent and unethical recovery housing operators, as that had been seen recently in other states. You may have heard in the media, there was a lot going on in the state of Florida about fraudulent and unethical recovery housing operators. And the bill required the Healthcare Authority implement a registry of HCA approved recovery residences, provide technical assistance to recovery residence operators through the state affiliate of the National Alliance of Recovery Residences, which is known as Walker, the Washington Alliance of Recovery Residences. Also to create and manage an operating revolving loan fund, and to create and manage a capital revolving loan fund. In Washington, we have a lot of different terms regarding recovery houses, recovery homes, recovery residences. So I just wanted to give you kind of a brief definition on how we use those terms here in the state of Washington. A recovery residence is a broad term describing a sober, safe, and healthy living environment that promotes recovery from alcohol and other drug use and associated problems. Recovery residents come in levels ranging from a level 1, which operates quite similarly to an Oxford house, all the way to a level 4, which in the state we call residential treatment facilities. A recovery house is actually a Department of Health licensed residential treatment facility offering specific services that are specifically described in WACT 246, 341, 1112. It's basically a billable service called recovery house. A recovery home is our generic term used to describe recovery residences, Oxford houses, licensed recovery houses, and tribal recovery homes. To work on the project for House Bill 1528, we've been including a lot of collaboration from outside agencies and partners. We convened a work group, and that work group includes recovery residents, owners, operators, substance use disorder treatment providers, Oxford House, tribal partners, and other state agencies. The work group was broken down into smaller groups to specifically focus on the 4 parts of the bill. On September 17th, we created an advisory group to assist with the revolving loan funds. It consisted of partners from HCA, Oxford House, the Fletcher Group, Walker, and the MCOs. We were working on creating the application and policies and procedures for the new operating revolving loan fund. And the advisory group will also assist in reviewing those applications once we start accepting them. Walker's role in all of this is as program support. HCA has contracted with Walker to provide technical assistance to anyone interested in recovery residences. Some of that assistance that we have asked them to provide is one-on-one technical assistance with owners and operators of recovery residences and people who are interested in setting up a recovery residence. They are going to be doing multiple webinars which cover best practices and emerging issues for recovery residences. They'll also be doing, hopefully, when COVID maybe kind of lets up a little bit, in-person events focusing on recovery house licensing through DOH and Medicaid reimbursement. They actually are going to be doing one of these events virtually, which will be later this month, I believe. They're also going to be doing some all-day intensive overviews of recovery residences, NAR models, emerging issues, and licensing and reimbursement. As of now, those are going to be scheduled virtually, but as I said, hopefully when COVID settles down to a decent, or whatever you want to call it, level, we can start doing those in person as well. One of the things we wanted to focus on with the recovery residences was creating a learning collaborative amongst all the owner operators, people interested in it. So we are, Walker already had set up a certification or accrediting process. And what we wanted to do was kind of encourage them to go towards more of that learning collaborative or fidelity review model, which they have embraced wholeheartedly. So they are doing fidelity reviews for upcoming and current Walker recovery residences. They also will be providing train the reviewer events for anybody that would be interested in assisting with doing those reviews and how that works. Walker is also providing expertise to HCA on recovery residences and the NAR model. Since this is a whole new program for us, it's nice to have the support of a group with that has some national perspective and knows kind of what's going on with the recovery residence world to help us out a little bit. So, as I mentioned, part of the things that the bill asked HCA to do was to create a registry. This registry is going to be housed and managed by HCA. It's going to be in a map form, which will allow people to search by county, by regional area, by the type of house that they're looking for to see to get contact information for them to go to. The registry includes Walker certified or accredited recovery homes. We also are including Oxford houses and any tribal recovery homes. We kind of wanted to make it a one-stop shop for everybody to find what will best fit and suit their needs. We are hoping, I'm going to change what's on here, but for a launch date at the end of the month, fingers crossed. And the registry is also for providers, because as of January 1st, 2013, substance use disorder providers will only be allowed to refer patients to the recovery homes on the registry. Our operating revolving loan fund that we were tasked to do is modeled almost exactly after the Oxford House revolving loan fund. It's a $500,000 total loan fund. The loans are $4,000. They're to be repaid over 2 years. As I said previously, we're working on the application process and policies and procedures. And we hope to have the funds available for application by October 31st of this year. Importantly to know, the funds are available for any nonprofit on the registry, and they can be used for operating startup costs, such as rent and mortgage, security departments, salaries, maintenance costs, to help them pay for licensing and certification through DOH, as well as setting up medication-assisted treatment policies and procedures for the residents. One thing I wanted to mention, in the state of Washington, through partnership with the Department of Health, HCA and Department of Health have mandated that level 1 and 2 recovery residences are considered housing in the state. Levels 3 and 4 provide treatment, and therefore they need to be licensed by the Department of Health. So we have these last few slides are just some resources for Oxford House recovery residences and some recovery supports. And that's all for me. Are there any questions?
We did have one question from an attendee. They said, I've observed registered sex offenders having comorbid conditions. Housing First is not usually available to these as far as I know are available. Do you have any information?
This Melody, I think that you know, again, the recovery house Oxford model, recovery residence model are really for individuals that identify as having a substance use disorder. So if that individual has a substance use disorder, this would be an opportunity for them to possibly and certainly Melinda can talk about this. The way that shared housing works in the Oxford House model and the recovery residences are generally the members of the house vote on who moves into that house. And so that's really where that mutual support, that shared support, peer support model comes in on the Oxford level 1 and NAR level 1 and 2. And so that process of people supporting each other, and so they vote to decide who moves in as a roommate in that single family residence in order to support each other in recovery. So Melinda, go ahead.
There's one small issue. If it's a sexual offender, they won't be able to go to an Oxford house just because most of those Oxford houses are also for children.
Thank you for that, Melinda. This is Milena. I want to add a little bit more to this conversation. When it comes to special populations, there are definitely opportunities within the treatment community to work alongside a housing provider and a treatment provider to come up with a scenario that is appropriate for the individual, as well as the community, right? And so this is the piece where criminal justice system, housing providers, and treatment providers come together to support special populations in specific settings. There are folks out there who do house individuals that don't maybe fit the eligibility criteria for other places. That can be tricky, and it has been done. And when we think about a person's ability to participate in this process, we usually see it become successful. There are some instances where the folks aren't aligned with, you know, the safety parameters that need to be put in place for certain situations, or somebody isn't willing to participate in that process. That's when those situations can get a little bit more challenging to address. In some cases, federal funding limits who you can house in a situation depending on how you're being funded and who you're receiving funding for. And so these are all of kind of the elements that we work to piece together as a community to solve problems and gaps in our system for specific populations. We all know that, you know, everyone needs a safe place to live and the treatment to support them in that circumstance. And that's what we strive to do by bringing folks together in this conversation.
Yeah, thanks, Melina. I just want to, build on that a little bit more too. And, that's where the continuum of housing resources and services and options, I think, are really crucial. And so, whether or not Oxford House or a recovery residence is that match for that person, we have those other services like foundational community supports, housing and recovery through peer services, PATH, Peer Pathfinder, that would all be providing the services to help make a match between what kind of housing is the best fit for that individual and what kind of conditions they need for their housing. And so there's, on that continuum of housing options that we're trying to develop, and specifically for foundational community supports, individuals coming out of prison that have that medical necessity of having a behavioral health condition could be served in the FCS program. Individuals coming out of inpatient behavioral health settings can be served by HARPS regardless of their legal status. And so there are other options on the continuum. Oxford and recovery residences, they would still need to have that substance use disorder to fit into these particular models.
Okay, at this time, we don't have any other questions. I will note that the team is aware there were some technical issues with some folks being able to access the session, and we just want to assure everyone that we did record the session and it'll be available post-event for up to a year for anyone to download. And I have encouraged anyone who is having challenges to try and connect with all of our speakers through their profiles if they have any immediate questions for today.
Well, thank you very much for the opportunity to share our continuum of resources in the Oxford House and recovery residence models, and hope that you'll reach out if you have any additional questions.
And thank you so much, Melodie, Melina, Melinda, and Kira. We really appreciate your time.
Thank you.
Thank you.